And I know a big slogan out there is detection is the key to, like, early detection is the key to survival. So definitely going and starting your mammograms, which the recommended start for an average woman is 40 years old. So at 40 is when my patients come in. I start giving them an order for a yearly mammogram screening. And definitely look into family history. Make sure, talk to your, see if you can get
Mhm.
any information or feedback from your mom, your grandma, because it can be genetic. I think you had asked me about some genetic issues with it. Some
Mhm.
women are just average risk because they've never had breast cancer, their mom hasn't, sister hasn't, aunt, grandma. That's my family. There are people that do. And we do special screenings, like computer entry screenings on those patients. If you come in and have a family history, I'll enter like your age and when your first period was, and if you're menopausal, and your weight, and if you've had children. And I enter this into a system called the Tyrer-Cuzick score. And if your risk is over 20%, you're at high risk. So we do more screenings on you. Or, like I said, depending on family history, we might talk to you about seeing a genetic counselor for some blood work to see if you have any genetic mutation, and that's where the BRCA1 and the BRCA2 mutations come in.
Yeah.
Um, BRCA1 is a gene that we have, and if that gene is mutated, the BRCA1 gene like cleans up like crappy cells or abnormal cells. If that
Okay.
gene is mutated, it can't clean up those crappy cells, and then that increases your risk of breast cancer. So, it's definitely something important to look into your family history.
In my family, my mom had breast cancer, my aunt had breast cancer. I had a cousin who was in her 30s with breast cancer, and then within the last 2 years, a niece was diagnosed with breast cancer. So when you have that, it's important that
Yeah.
you get the screenings, and generally when you have that kind of history, you start your mammograms earlier because of that
Mm-hmm.
risk factor. So to know, like I said, to know your family history is very important. If you can
Yes.
get that
So
information,
yeah.
give it
Right.
to your doctor.